Hello, how are you? Fine. I'm here to discuss with you the first aid session that we did today. It was first aid follow up. Hi, Liz, how are you? Okay, the first aid follow up we did today was so important. And I was shocked, although that I've done first aid sessions for years everywhere. This session was truly unique. As you remember, the first time we had we're gonna do the first aid session every Monday at 5 Beirut time. It's with a specialist. She's a registered nurse, and she is a specialist with the Red Cross, and she was a trainer as well. So last time, what we did was the emergency number that we need to have. We did the emergency box. What do you need inside the emergency box, the first aid box? Where to place the first aid box? We said it's very important to have written the numbers of the emergency lines that are the police, the Red Cross, the fire department, the hospital, the doctors if you have specific cases or children in the house. And last that we are adding now in Lebanon is the abuse center, because with the lockdown the number of abuse cases is increasing in the houses. So those are the numbers that we need to have. And what we discussed today additionally, what's important to have in your wallet a card where your blood type is printed on it. So it could be either the driver's license if it's on it, or if not, you just add it on the you have to have a specific card issued by the authorities. This is one. The second thing we did today, last time we did the surface injuries, okay? Today we did the burns, because burns are so important, and we always report back to reminding people it's better to know what to do than to panic in case of emergencies. So as we say, it was about the first degree, second degree, and third degree burn. I don't know if it happens in your area, but in our country, people go really out of I don't know how to say it. People really get into listening and reading theories here and there when it comes to burns. And the recommendation was for the first degree burn, which means that the spot is only red. You just put cold water, okay? For the second degree burn, and that is when you have a blister, you put as well you flush it with cold water, because that's all you need to do. You never put flour, toothpaste, or whatever. The first thing you do always is cold water to let the burn cool. And then the third degree burn, it's when the burn reaches the inside of your flesh. That's when you directly wrap it with something in cotton, and then you transport the person to the nearest hospital. That's why it is important to know important to know where is the nearest hospital that deals with burns. In Lebanon here, we know there are two hospitals that deals with burns, and those are very important for us to know. So therefore, this is what we do. So we informed everyone about what to do with burns. First degree, second degree, third degree, and definitely in case of shock, because many people, whether you are the injured or you are the person assisting, many people get into a state of shock when there is injury. So what do we do with injury? The first thing you have to, there are three things you need to remember. You have to test the head. Is the person talking and understanding what you're saying? Is he not hallucinating? When you ask him, how did the injury happen? Where do you live? How old are you? Etc. Is he breathing? This is another sign that you need to check. And the third sign is the heart working, and you test the heart from here. You never test the heart with the thumb, you always test the heart with those two fingers. You put them here on the triangle between the jaw and the throat. You find your triangle, and then you put that. So this is the second thing. This is what you test in case of injury. And we discussed as well what to do. This is the external burn, and she said anytime the burn is bigger than the palm of your hand, okay, you have to directly head to the hospital. And then please don't put it bigger than your hand if you're testing it on a baby. Okay, a baby, it's the palm of his hand, please. And then after that, she said, why we don't put anything, because some people say put your hand in flour or put toothpaste or etc. Because if you feed the burn, when you go to the hospital, they have to scrape it, which means that you will be hurting the burn twice. So that was the external burn. But anytime the burn is in the face or in the, like under the waist, in the part that are private, directly you have to head to the hospital, even if it's small, to the medical attention. The second thing we discussed, if you inhaled the chemicals and you created internal burns, because like a lot of things happen in our houses that are really wrong, where we put, sometimes we want to disinfect our bottles, we put in it eau de javel, Clorox, and then someone can just come grab the bottle and drink it. Just to let you know, it happened to me when I was young. This is one. Or sometimes they use the glass cans to restore chemicals that you will be using in the garage or something. So those, at level of children or at level of adult, I was a child when I drank the Clorox. I'm not going to tell you what happened, but I guess you need to know. Anyways, so people can just grab the bottle. That's why anything toxic should not be at anybody's reach, because if you are not there to tell people do not drink it, even if you can post a post on it, people do not read what's written. So it is better to know what to do. To know what you put in those bottles. Anyways, in case someone drinks toxic liquids, just directly he needs to go to the hospital. Please make sure that this person does not remain at home. He should directly head to the hospital. If you don't know what's in the bottle, please make sure you take the bottle with you to the hospital so they can test it. This is one. And when they drink something that is toxic, make sure that you just keep on talking to the person. And if they smell toxic, let's say they are cleaning the bathroom or something and they use too much chemicals, or sometimes what people don't pay attention to is they use two chemicals that when they interact together, they form like a smoke or something. If someone inhales it, as they're drinking or inhaling, they will be burning the canal until they reach the stomach or the lungs. So that's why people need to be careful. You just want to make sure they are breathing and get the necessary attention. Other than that, you have to remember, like a lot of times they tell you, if you drink something poisonous, drink milk. Please do not drink anything, because like when you, or do not ask the person to throw up, because once they do, as things burn on the way in, they will burn again on the way out. And do not drink anything. Just let the medical people handle everything. The last thing you need to remember before, the best thing for fire, whether it's external or external, the first thing, if you think about it, what are the things that burn? Okay, oil on the stove, coffee, Nescafe, etc. Everything that is handy, or while you're cooking, or sorry, or like if you're ironing and the iron is there and someone will hold on to the thing, to the cord. So those are the things that will really burn people. So that therefore you have to be extremely careful when you are cooking on the stove, or you're having your coffee. On the stove, always have the handles to the inside, not only because kids might come and grab the handle and throw things, but even adults. If you are cooking and your hand or the rope got stuck with the handle of the pot, you can drop the pot on you or on someone else. So those are the measures that you need to take. It's safety measures. The plugs, make sure the child cannot put anything in, because electricity burns as well. So those are the things that are related to burns. The last point we discussed was the nosebleed. The best thing that recommended in case someone falls and has a nosebleed or something, do not cause any pressure, do not do anything, just get the gauze, roll it and put it underneath, trying to stop the blood from dripping. Just put it on the outside, nothing else, no stopping, no pressure, no nothing. But the only case where you cause pressure, okay, is you cause the pressure on this side here, that is between the nose and the vein on the inside. Usually people who has nosebleed, they know that they have this condition. It could be probably dryness, or it could be from the heat, or it could be like just emotional or something. Therefore, what's important to know, and please hear this tip that was so important, and after checking it today, I'm going to tell you what happened. If someone has blood pressure and high blood pressure, okay, this will cause his nose to bleed. You should never stop the bleeding. If you stop the bleeding, it means you are causing more pressure, and the blood pressure will go higher. And this is what happened, it turned out, with one of the people here in our area who was 40 years old. He had nosebleed. He went to the pharmacist. The pharmacist gave him something to stop the nose bleeding, and the guy died because it turned out that he had a case of high blood pressure. So therefore, when you say high blood pressure, you do not stop the bleeding. But if someone knows that they have a case, and that case where your doctor already administered for you a medicine to put on your nose, on the vein, to stop bleeding when it does, please make sure that you get a gauze, you roll it. After you pressure here, okay, for 10 minutes. If it doesn't stop, this means, as administered by your doctor, you have to get a gauze, put on top of, fold it in a triangle. I'm gonna show you. This is the gauze. You fold it in a triangle, and then you roll it. You put the medicine, and then you take it in, and you keep on rolling until you feel that it's touching the top. where you start throwing tears, it means it touched the top. I'm sure the doctor will teach you, but this is not what I want you to know. I want you to know that in case of nose bleeding, please keep your head straight aligned with your spine and body. Do not lay down, do not tilt the head to the back. Keep your head straight, because if you tilt the head to the back or to the front, you will suffocate. You can no longer breathe because you have dripping. To the back, the blood will go down to the stomach, and the stomach cannot digest the blood. So please make sure you keep the head straight, and you follow the instruction of the doctor to stop the bleeding. Please make sure if someone has high blood pressure, not to stop the bleeding. Anyways, always consult with the physician. What we are doing is simply giving instruction of first aid until official help is there. Always remember that you do not need to panic. Remain calm, remain at ease. I will be seeing you every Monday after our session to give you the summary of whatever we've done. Anyone has any question regarding the first aid session? Let me know. I'll give you a minute. Nice group of people today. Hello, we are fine. If you have any question, please let me know. Otherwise, thank you very much for listening. I hope you will not need the instruction. Just remember to remain safe and to keep everything safe in the house. Take care of yourself, take care of the people around you. Bye-bye.